their classification. There are some of the types, especially alkylating agents. Then we have jumped to some platinum compounds, which are heavy, which is considered as a heavy metal one. Then we have talked many of the natural products in a few of the sessions. Vincristine, vinblastine, podophyllatoxin, Taxol. So all of them are basically kind of anti-cancer agents, and they are used in cancer. So today is basically we are going, after having a discussion on these anti-neoplastic agents, their class, purine and metabolites as well, where we discuss many of them. So we are going to discuss today a new topic for and that one is hormonal drugs. So this is also a kind of class of anti-neoplastic agents, or what is called this anti-cancer agents. So what are these hormonal drugs? So some of the hormones which are present in our body, they are controlling several kinds of, I can say, homeostasis in the body. So homeostasis, basically they try to perform the balance of certain intermediates, which we used to call carbohydrate, protein, lipid, or sugars. Cholesterol is also there because cholesterol gives mass. So these hormones are essential. Just like if we have the deficiency of this hormone, there can be certain disease. If we have excess of particular hormone, then it can also result in disease. It's like hyperaldosteronism, which is a kind of condition resulted because of excessive secretion of aldosterone. That's why it is the term as hyperaldosteronism. And many times other hormones are also there. So just like growth hormone. So excessive concentration of growth hormone can cause abnormal growth. So that is there. And the deficiency of the hormone can also cause the certain disorder. For example, dwarfism, which is basically the deficiency of particularly this growth hormone. So several kinds of these hormones are there, and there, if their level is not maintained into the body, then they may result in cancer. Okay, so what are these? How can we use this? For example, if there is certain disease condition where hormonal level is higher than that the normal level, जो नॉर्मल लेवल होता है उससे जो हार्मोन का कंसंट्रेशन है बहुत ज्यादा है, then we can give the inject some drugs to the patients which will reduce the level of particular hormone into that body. Or if the level of hormone is less, so under this condition we can give from exterior, from outside, we can inject those hormones from outside. Okay, so this thing is basically possible. So that's why many of the drugs are, if you can see, they belongs to steroidal category. So what are the steroidal compounds? They are basically pentacycloperhydrophenanthrin class of the compounds, and here we have seen glucocorticoids. So this is glucocorticoids. Basically, prednisolone is the structure of this drug, and that is cyclopentaperhydrophenanthrin nucleus is present into this one. And here this is a cyclic ketone, conjugated ketone, cyclic 1,3-cyclohexa, we can call cyclohexanone, is present in the structure of glucocorticoids. Then it comes to this estrogen. So basically, foestrol and ethinyl estradiol, these are the estrogen, some of the other hormones, and they are generally associated with estrogen. Is basically one of the predominant sexual hormone in the female, and these are the hormones which can be given into this. Then selective estrogen receptor modulator, tamoxifen citrate. These are the drugs which are used in breast cancer. So tamoxifen citrate is basically this drug, and we can see this is also a non-heterocyclic compound which possesses 3 aromatic rings into its structure. Here we can see this is basically this is basically cis, or a kind of compound which is having carbon-carbon double bond in here, And we know the stereochemistry of alkenes. So alkenes can be classified according to either cis or trans, or capital E or capital Z. So selective estrogen receptor modulator, this modulators, SERM is the abbreviation of this class of the drugs, where these are tamoxifen. Basically, they are having a double bond, that is capital Z. So capital we can call as capital Z or Z is a structure for this stereoisomerism in selective estrogen receptor modulator. And tamoxifen is basically available in the market as a citrate. So tamoxifen citrate is the name of this drug, right? And selective estrogen receptor down regulator. So down regulator means they shall try to reduce the level, and one of the drug is fulvestrant. So fulvestrant is basically trifluoro. This is fluorinated analog, and that was a sulfon moiety into the structure, and here it is having aromatic phenolic OH in the structure of fulvestrant. Aromatase inhibitor. So aromatase is the enzyme which is basically these aromatase inhibitors are again used in breast cancer. So letrozole, anastrozole, and exemestane, these are the drugs. Letrozole is basically this is 1,2,4 triazole. So triazole analog, and that is associated with this bis 4 cyanophenyl methane is the structure. This letrozole analog, and that is having 1,2,4 triazole analog. This is also 1,2,4 triazole analog, but in this case it is little different because here we were not having this female benzonitrile on this methyl of this ring, so that's why it is termed as anastrozole. Exemestane. So exemestane basically that is also cyclopentopper hydrophenanthrin analog and cyclic steroidal analog, and that is also showing inhibitory activity against aromatase enzyme. And clinically, it is used for the treatment of breast cancer. Flutamide. So flutamide is the drug where it possesses this trifluoromethane. So the trifluoropenam C, flutamide namide. And amide is there. So basically, it possesses this anilide, paranitroactive anilide is a structure. So, and they are anti-androgens. So, anti-androgens means basically androgen is a sexual hormone of the male, and that is testosterone. So, these are the substances they are going to reduce the level of concentration of this testosterone into the body, or we can call androgens into the body. And this is their structure. Bicalutamide, flutamide and bicalutamide, they are also this kind of structure. And here again a non-intracyclic kind of compound, but yes, carboxylic ring. Carboxamide is the pharmacophonic feature of bicalutamide, and that possesses this benzonitrile substitution is there. So basically, we can see one common observations from flutamide and bicalutamide that more they are having electron withdrawing groups such as CF3 and cyano, or even sometime nitro. This activity is more antigens activity is increased. So indeed, androgens are such kind of. 5-alpha reductase inhibitor, finasteride. Basically, finasteride and dutasteride are this class of the drug, and that is the methylamide derivative 5-alpha reductase. Gonadotropin releasing hormones, so they are the peptides because these are no more than the peptidic structure which are essential for showing the inhibitory activity. Okay, then progestin and some other analogs are there. So likewise, these are basically really used for the purpose of anti-neoplastic agents. So with this, I think I have covered almost all of them anti-neoplastic agents which are essential for anti-cancer activity. And these are the drugs basically sometimes they are a cancer is basically they say people are telling that to avoid the bad habits is the major common cause. To avoid the bad habit is the only way of prevention to prevent yourself from the cancer, such as chewing the tobacco, chewing then bidi, tobacco, cigarette, or whatever, Erica catechu, that is also can cause the cancer. Some soft drinks, such as Coca-Cola, with Sprite, with ye, wo, so many things are there. They can also cause the cancers. Some of the hardcore preservatives which are used in packed foods, foods which are used in packaged foods, or they also, if you have a habit of eating such kind of foods, and so develop the cancer, whether it is your colon cancer, intestinal cancer, whatever. Okay. Leukemia is also a kind of a blood cancer. Sarcoma is a kind of skin cancer. So there are so many types of the cancers. So prevention is always better than cure. If we prevent ourselves from any kind of disease conditions, then we will be able to prevent ourselves from the cancer. So that is the way. That is one of the way that we can discuss it. Right? Otherwise, cancer can be treated with all of these chemotherapeutic agents, but the side effect of these chemotherapeutic agents is higher, that they will cause baldness, hair loss, then sometimes excessive kind of this vomiting, nausea, and patient will lose the weight because of this nausea and vomiting will not, something will not go into the food, will not be able to be digested into the body. So that is the side effect of this. And parallelly, it can also cause some kind of other GI disturbances as well. And many of the other anti-cancerous drugs, they are causing anaphylaxis, so side effects are also predominant. So that basically I wish to discuss with you, and we shall be stopping up to here. And if you have question or something else, so